So when we first got into treating with stem cells, the idea was to have the stem cells produce tissues. So when you had conditions such as arthritis, where you have loss of cartilage, conditions where you have torn muscle or torn tendons, what we originally assumed was that you would put these stem cells in and they would go to the area where the problem was and they'd start producing those cells. What we found actually is that the way the process seems to happen is that there is some of that occurring where the stem cells are directly put in an area, say loss of cartilage, and they do produce cartilage cells. They are themselves converted into cartilage cells. However, that seems to not last very long, and those cells actually go away. What seems to be the most important thing that we're finding is what those cells are bringing with them. Not the cells themselves, the proteins and the enzymes. And actually, when those cells, they burst over a certain amount of time and they release all of these enzymes and proteins, that causes your own cells to start producing the cartilage or becoming stem cells themselves. So presently, that seems to be almost the most important way that this is accomplished. And so a patient who typically gets this type of treatment usually goes through 2 phases. The first phase is a very, very strong anti-inflammatory phase. So everybody gets anti-inflammatory phase from stem cells. And what that means is when you have inflammation and swelling and it hurts, it takes that away and it does it very well for usually about a 6-month period. So everyone gets very good relief for 6 months for inflammation. Now, as that inflammation goes down, that's when the process, we believe, starts where the cells start laying down the new cells. That can take anywhere from 6 months to a year process, and that is what we're trying to follow up more longer term to see how good those effects and how long-lasting those effects are. There's some recent studies on discs in the lower back that shows that we have seen some significant disc regeneration with the stem cell use, but we need more studies and longer outcomes to make sure that that is being 100% effective.